It is now my great pleasure to be joined by Dr. Kristen Nadeau, recipient of the 2021 Outstanding Scientific Achievement Award. Thank you so much for being here. I want to say congratulations to you.
Well, thank you so much for having me. It's a pleasure.
Let's look back. How did you begin looking at insulin resistance in youth, and what was known about the mechanisms behind it at the time? And if you can talk about how you feel you've contributed.
I started by working in the lab with Dr. Boris Drasnin, and we looked at the bench at cell culture and looking at mechanisms of fat deposition and how that was related to insulin resistance. And at the time, we thought that people with type 1 diabetes were insulin deficient but not insulin resistant. But as I moved to working on clinical research and understanding more what was going on with youth with diabetes, realized that kids with type 1 diabetes were actually very insulin resistant as well, but with really different mechanisms. And so that's what I moved into then, is trying to understand how the kids with type 1 diabetes were different from those with type 2.
How would you say this work affected the way young people are treated for diabetes?
So what has changed with the work that we've undergone is that initially people thought that kids with type 2 diabetes should be treated exactly the same as adults, and we were using the treatments that existed for adults with type 2 diabetes. But unfortunately, we found that many of them are not as effective in kids, and that we need to be even more aggressive than we thought we would be with kids. And now one of the most effective treatments in kids with type 2 diabetes looks like it may be bariatric surgery. But we really want to better understand the mechanisms underlying that so that we don't have to do surgery.
What drives you to do this work? Why is understanding the complications associated with diabetes in youth getting increasingly more important?
So I'm Prairie Band Potawatomi on my father's side, and when I went into medicine, I wanted to do something that was important to the American Indian population, and chose diabetes because it affects our people to such a large degree. And so that's what really drives me, as does trying to understand why youth have a sex predominance such that girls have a lot more type 2 diabetes than boys do, and trying to understand what it is that's causing this disparity in girls.
What can attendees expect from your talk at the meeting?
What I'd like to talk about at the meeting is some myths that I think are blocking us from preventing cardiovascular disease and complications in diabetes, and ways that we can think differently about the mechanisms underlying insulin resistance in order to get to the next step of developing new treatment.
Well, thanks again for joining us, and best of luck for the future in this exciting work.
Well, thank you so much for the opportunity.